Hello, my name is Eleanor and I am a Refsum's dietitian, and I'll be sharing this presentation with Sarah, who is the Refsum's dietitian for St Thomas's Hospital. So we would like to talk to you about this topic, illness and fasting, and how they can affect you when you have adult Refsum's disease. Next slide, please. So what is the evidence of harm from fasting or illness in people with adult Refsum's disease? Well, the first evidence came from a fasting study that was carried out in 5 patients. And this fasting study, we know that the patients were definitely fasted because they had ketones in their urine. And what the study found was that an individual's phytanic acid level doubled within a period of 29.2 hours. So what that means is that if a person with a phytanic acid level of 400 fasts for 29.2 hours, then theoretically their phytanic acid level would be 800 at 29.2 hours, whereas a person with a phytanic acid level of 800 to start off with, if they fast for that period of time, then they would have a phytanic acid level of 1600 after 29.2 hours. So clearly, the implication is that the higher your phytanic acid level when you start fasting, the higher your phytanic acid level will be when you fast. Some other evidence for this harm from fasting or illness came from some people with adult Refsum's disease who gave birth, so who had children. And some of our patient cohort, in fact, were found to have adult Refsum's disease directly because they had given birth and they developed a lot more symptoms after they had given birth. And we believed that this was because of the weight loss that had occurred after giving birth. We have also found that a significant number of people with adult Refsum's disease contact the service describing an increase in their phytanic acid readings because they've just had surgery or because they've had an intercurrent illness like a gastroenteritis, or they've experienced some deliberate or unintentional weight loss. So there's quite a bit of evidence that fasting and weight loss cause problems to people with adult Refsum's disease. So what can you do if you need to have a surgical procedure or if you are injured? So we would always recommend that you contact your Refsum's physician if you know that you are going to have a planned surgical procedure, so that your team can liaise with the surgeon to make sure that you're fasted for a minimum period of time. So we would often ask for patients to be put first on the list with the surgeon, and that you are placed on a drip after surgery, which provides glucose until you're able to eat and drink. So people without adult Refsum's disease who have surgery, surgeons would often wait until people have what's called bowel sounds before they are provided with any nutrition. And that wouldn't be the right thing to do with a person with adult Refsum's disease. We would want them to be given glucose, which is a form of carbohydrate, as soon as they are out of theatre. Your Refsum's dietitian will also be able to liaise with your hospital dietitian to explain the diet that you'll need to follow while you're an inpatient, and what forms of enteral feed would be suitable if you need oral nutritional supplements or if you require tube feeding after your surgery. So it's quite important to put those health professionals in touch with each other. Most hospitals will have at least one dietitian servicing them. So it's just important to contact the dietetic department and they will liaise with your Refsum's dietitian. If you have other conditions that affect your dietary management or your nutritional management, so such as diabetes or reactive hypoglycemia, then again, your Refsum's dietitian will be able to advise on any modifications that you need to follow in preparation for surgery or procedures. So often when people have to go for, say, a colonoscopy or another procedure like that, they are given standardized dietary advice on their pre-procedure diet. And that pre-procedure dietary information may not be suitable for a person with adult Refsum's disease if they have other conditions, or it may not be suitable for people with adult Refsum's disease whether they have other conditions or not. It's just simply important that there is that liaison, that if it's a procedure that you're going for, like a colonoscopy, that you perhaps contact your Refsum's dietitian, who can advise you whether or not the information that you've been given about the preparation for the procedure should be followed in its entirety, or if it needs to be modified. So I think the buzzword really is communicate. Please communicate with your Refsum's team and communicate with the people who are performing your procedures or your surgery that you have this condition, and these are the contact details for your team. So is minor illness important? So minor illness, may seem to you as just something minor, like a cold or a gastrointestinal infection such as food poisoning. But these situations can also be an emergency. So if you have a cold, your appetite may be poorer, you may find it more difficult to eat and drink your normal amounts. And that can generate an emergency because it can cause you to lose weight, and that can cause you to break down your adipose tissue, which can increase your phytanic acid levels. So something as minor as a cold does actually mean that you need to think about your adult Refsum's disease, and you may need to follow your emergency regimen. And the same would definitely be the case for food poisoning, where, or any situation where you are unable to eat and drink normally.
So as Eleanor said, illness can be an emergency. And so what do you need to do? If you're feeling unwell, nausea, vomiting, diarrhea, high temperatures, or you're experiencing any loss of appetite, anything that means that you're not able to eat your normal food, there is a chance then that the body is not able to get adequate fuel and will start to break down fat stores, which will release phytanic acid into the body. So we would recommend during any time of illness to have a regular source of glucose, and this could either be via what we call a nutritional supplement drink or an emergency regimen, which should be started immediately. And as Eleanor said, the buzzword is contact your team. So at any time that you have this illness, because illness can vary in so many different ways and in severities and type of illness, it is important to contact the team because they can give more individualized or tailored advice on how to manage during the time, and also keep in close contact with you to make sure that things are okay. So I'm going to just briefly talk about a home emergency regimen, and this is the regimen that we use at St Thomas's Hospital in London for our patients with adult Refsums. So we would recommend having a prescribed glucose polymer drink that can be made up to a 20% concentration to take during times of illness. And I've listed some of the products that we might use, such as Maxigel, Vitagel, Polycal, or SOS 20. So these are products that are available in the UK, and I know are available, maybe not all of them, but some of them, or different versions or alternatives to these products. But ultimately, they're all products that contain just glucose. And your team can advise on helping to find which is the best product for you. The emergency regimen we recommend has three key stages. The first stage is at any sign of illness or loss of appetite to make up one of these drinks, 200 mils at a 20% glucose concentration. So the volume might change depending on what product you're using. So again, should be guided on by your team on this. But we would use, if for example, someone was using an SOS 20 sachet, that would be made up with 200 mils to make a 20% glucose drink. So someone would drink the drink and wait an hour to see how they feel. If they're feeling back to themselves, back to normal health, to continue with their usual routine and their usual diet. But if after an hour someone continued to feel unwell, we would recommend progressing then on to stage 2 or stage 3. Stage 2 is commencing a full emergency regimen, and this is taking one of those the glucose polymer drinks every 2 hours, night and day. And the purpose of this really is to give your body a constant source of fuel so that it isn't needing to rely on breaking down fat stores in the body, which will push up vitamic acid. The hope is that this regimen will be just for a short day or two while someone was recovering from an illness. And hopefully will also keep you out of hospital, as it will be providing a good source of fuel. So if someone is able to tolerate the drink every 2 hours, they should continue with that for stage 2, but to also contact their physician and their team, their Refsum service, to make them aware that you are unwell and you started on this, and therefore they can be a more regular contact and advise and support. If someone isn't able to tolerate the emergency regimen, they have diarrhea, vomiting, they just can't keep the drink down, then it is important that they present to hospital, because they may need a drip form of the IV glucose to give that source of fuel. Also, if after 1 to 2 days the person is not feeling any better, they haven't improved, or they're becoming increasingly unwell, they should present at hospital and get more investigations and further advice and support and medical management. Those are the 3 key stages that we would advise in the home emergency regimen. What I would recommend is, if you haven't already, is to listen to the presentation by Dr. Ramachandran running through the service at Guy's and St Thomas's. As part of that presentation does talk about medical procedures and also the IV regimen. And that applies to, as Eleanor said at the start, if you have a planned procedure or you end up in hospital, you would need to start on a drip form of glucose if you aren't able to eat a drink. But equally, in this illness phase where you might end up in hospital and be requiring IV glucose or IV dextrose, that presentation just guides through some points around that. So I'd recommend seeing that for further guidance on the more medical management side. Thank you.